Question 1. A 68-year-old male with a history of chronic heart failure is admitted with worsening dyspnea, bilateral crackles, and 3+ pitting edema. He is prescribed 4-furosemide. Shortly after administration, his blood pressure drops from 128/76 mmHg to 92/58 mm of mercury, and he reports dizziness. What is the nurse's priority action? A. Administer a second dose of furosemide. B. Place the patient in a supine position and reassess vital signs. C. Notify the healthcare provider immediately. D. Encourage oral fluid intake. Answer: B. Place the patient in a supine position and reassess vital signs. Rationale: the patient is experiencing symptomatic hypotension likely due to diuresis. Immediate intervention includes positioning to maintain perfusion while reassessing stability before escalating care. Question 2. A patient with diabetes mellitus type 1 is admitted with confusion, sweating, and tremors. Blood glucose is 48 mg per deciliter. The patient is alert but unable to follow complex commands. What is the most appropriate initial intervention? A. Administer 10 units of regular insulin subcutaneously. B. Provide 15 grams of fast-acting carbohydrate orally. C. Prepare for intravenous insulin infusion. D. Restrict oral intake and monitor glucose. Answer: B. Provide 15 grams of fast-acting carbohydrate orally. Rationale: the patient is hypoglycemic and conscious. Immediate treatment is fast-acting carbohydrates to quickly raise blood glucose levels. Question 3. A postoperative patient who had a total hip replacement 24 hours ago suddenly reports sharp chest pain, dyspnea, and anxiety. Oxygen saturation drops to 88%. What is the nurse's priority action? A. Encourage deep breathing exercises. B. Place the patient in Trendelenburg position. C. Administer oxygen via nasal cannula. D. Prepare for discharge teaching. Answer: C. Administer oxygen via nasal cannula. Rationale: the patient likely has a pulmonary embolism. Immediate oxygen support is critical to maintain oxygenation. Question 4. A nurse is caring for a patient receiving a blood transfusion who develops fever, chills, and back pain 10 minutes after initiation. What is the nurse's first action? A. Slow the transfusion rate. B. Continue transfusion and monitor closely. C. Stop the transfusion immediately. D. Administer antipyretic medication. Answer: C. Stop the transfusion immediately. Rationale: these symptoms indicate a possible transfusion reaction. The transfusion must be stopped immediately to prevent further harm. Question 5. A patient with chronic kidney disease has a potassium level of 6.5 milliequivalent/L and ECG changes showing peak T waves. What is the priority intervention? A. Administer sodium polystyrene sulfonate orally. B. Administer 4-calcium gluconate. C. Encourage a potassium-rich diet. D. Start oral potassium supplements. Answer: B. Administer 4-calcium gluconate. Rationale: 4-calcium stabilizes cardiac membranes and prevents arrhythmias in severe hyperkalemia. Question 6. A patient is receiving a heparin infusion. The nurse notes bleeding gums and a PTT significantly above therapeutic range. What is the nurse's priority action? A. Increase the infusion rate. B. Stop the infusion and prepare to administer protamine sulfate. C. Administer vitamin K. D. Document findings and continue monitoring. Answer: B. Stop the infusion and prepare to administer protamine sulfate. Rationale: these are signs of heparin toxicity. Protamine sulfate is the antidote. Question 7. A patient with COPD is receiving oxygen therapy at 6 liters per minute via nasal cannula and becomes increasingly drowsy with decreased respiratory rate. What is the nurse's best action? A. Increase oxygen flow to 10 liters per minute. B. Reduce oxygen flow and notify the provider. C. Encourage coughing and deep breathing. D. Switch to a non-rebreather mask. Answer: B. Reduce oxygen flow and notify the provider. Rationale: COPD patients are at risk of CO2 retention with high oxygen levels. Decreasing oxygen and notifying the provider is appropriate. Question 8. A patient with a recent stroke is at risk for aspiration. Which intervention should the nurse implement first? A. Place the patient in supine position for feeding. B. Keep the head of the bed elevated at 30 to 45 degrees. C. Offer thin liquids to promote swallowing. D. Insert a nasogastric tube immediately. Answer: B. Keep the head of the bed elevated at 30 to 45 degrees. Rationale: elevation reduces aspiration risk during and after feeding. Question 9. A nurse is assessing a patient with suspected meningitis. Which clinical finding is most concerning and requires immediate action? A. Headache and photophobia. B. Positive Kernig's and Brudzinski's signs. C. Temperature of 38.5 degrees Celsius. D. Nausea and vomiting. Answer: B. Positive Kernig's and Brudzinski's signs. Rationale: these are classic signs of meningeal irritation and indicate possible meningitis requiring urgent intervention. Question 10. A patient is receiving morphine for pain management after surgery. The nurse notes a respiratory rate of 8 breaths per minute. What is the priority intervention? A. Administer naloxone. B. Encourage the patient to ambulate. C. Reassess in 30 minutes. D. Increase the morphine dose. Answer: A. Administer naloxone. Rationale: the patient is experiencing opioid-induced respiratory depression. Naloxone reverses opioid effects. Question 11. A 56-year-old patient with sepsis is receiving aggressive 4-fluid resuscitation. Despite this, blood pressure remains 82/50 mmHg, MAP is 58 mm of mercury, and urine output is minimal. What is the nurse's priority next action? A. Increase 4-fluid rate further. B. Administer a vasopressor as prescribed. C. Place the patient in high Fowler's position. D. Restrict fluid intake. Answer: B. Administer a vasopressor as prescribed. Rationale: persistent hypotension after fluid resuscitation indicates septic shock requiring vasopressors to maintain perfusion. Question 12. A patient with diabetic ketoacidosis, DKA, is receiving 4-insulin therapy. Blood glucose drops from 450 mg per deciliter to 210 mg per deciliter within 2 hours. What is the nurse's priority action? A. Stop insulin infusion. B. Add dextrose to 4 fluids. C. Increase insulin rate. D. Administer glucagon. Answer: B. Add dextrose to 4 fluids. Rationale: rapid glucose drop increases risk of hypoglycemia. Dextrose is added to prevent complications while continuing insulin. Question 13. A patient who had a thyroidectomy 6 hours ago suddenly developed stridor and difficulty breathing. What is the nurse's priority intervention? A. Administer pain medication. B. Check surgical dressing. C. Prepare for emergency airway management. D. Encourage coughing. Answer: C. Prepare for emergency airway management. Rationale: stridor indicates airway obstruction, possibly from swelling or hematoma. This is a life-threatening emergency. Question 14. A nurse is caring for a patient with increased intracranial pressure, ICP. Which action should the nurse avoid? A. Elevating the head of the bed to 30 degrees. B. Suctioning the patient frequently. C. Maintaining neutral head alignment. D. Reducing environmental stimuli. Answer: B. Suctioning the patient frequently. Rationale. Frequent suctioning increases ICP and should be minimized. Question 15. A patient receiving chemotherapy has a neutrophil count of 500/mm superscript 3. Which intervention is the priority? A. Encourage fresh fruits and vegetables. B. Place the patient in protective isolation. C. Administer live vaccines. D. Allow unrestricted visitors. Answer: B. Place the patient in protective isolation. Rationale: severe neutropenia requires infection prevention through protective isolation. Question 16. A patient with acute myocardial infarction suddenly develops ventricular tachycardia without a pulse. What is the nurse's immediate action? A. Administer amiodarone. B. Begin CPR and defibrillate. C. Check blood pressure. D. Administer oxygen. Answer: B. Begin CPR and defibrillate. Rationale: pulseless VT is a cardiac arrest rhythm requiring immediate CPR and defibrillation. Question 17. A patient with SIAD has a sodium level of 118 milliequivalent/L and is confused. What is the nurse's priority intervention? A. Encourage oral fluids. B. Administer hypertonic saline cautiously. C. Restrict sodium intake. D. Provide hypotonic fluids. Answer: B. Administer hypertonic saline cautiously. Rationale: severe hyponatremia with neurological symptoms requires controlled correction with hypertonic saline. Question 18. A burn patient 12 hours post-injury has decreased urine output and rising hematocrit. What is the nurse's priority action? A. Decrease fluid administration. B. Increase fluid rate. C. Administer diuretics. D. Monitor daily weight only. Answer: B. Increase fluid rate. Rationale: findings indicate hypovolemia, fluid resuscitation must be increased to prevent shock. Question 19. A patient with a spinal cord injury at T6 develops sudden hypertension, bradycardia, and a pounding headache. What is the nurse's first action? A. Lay the patient flat. B. Sit the patient upright. C. Administer antihypertensives immediately. D. Provide oxygen. Answer: B. Sit the patient upright. Rationale: this is autonomic dysreflexia, sitting upright lowers blood pressure immediately. Question 20. A nurse is assessing a patient with suspected compartment syndrome. Which finding requires immediate action? A. Mild swelling and bruising. B. Pain relieved by analgesics. C. Severe pain unrelieved by medication. D. Warm skin over the affected area. Answer: C. Severe pain unrelieved by medication. Rationale: unrelieved pain is an early and critical sign of compartment syndrome requiring urgent intervention. Question 21. A 72-year-old patient with pneumonia becomes increasingly restless, with oxygen saturation dropping from 95% to 86% despite oxygen at 4 liters per minute via nasal cannula. What is the nurse's priority action? A. Increase oxygen to 10 liters per minute via non-rebreather mask. B. Encourage oral fluid intake. C. Document findings and reassess later. D. Place the patient in supine position. Answer: A. Increase oxygen to 10 liters per minute via non-rebreather mask. Rationale: rapid desaturation and restlessness indicate worsening hypoxia requiring immediate escalation of oxygen therapy. Question 22. A patient with acute pancreatitis reports severe abdominal pain and begins vomiting. Which intervention is the nurse's priority? A. Administer oral analgesics. B. Initiate NPO status. C. Encourage high-fat diet. D. Place patient in Trendelenburg position. Answer: B. Initiate NPO status. Rationale: pancreatic stimulation must be minimized. Keeping the patient NPO reduces enzyme secretion and inflammation. Question 23. A nurse is caring for a patient with suspected tension pneumothorax. Which finding requires immediate intervention? A. Decreased breath sounds on one side. B. Tracheal deviation. C. Mild chest pain. D. Slight tachycardia. Answer: B. Tracheal deviation. Rationale: tracheal deviation is a late, life-threatening sign of tension pneumothorax requiring immediate decompression. Question 24. A patient with liver cirrhosis develops confusion, hysterexis, and elevated ammonia levels. What is the priority nursing intervention? A. Administer lactulose. B. Increase protein intake. C. Restrict fluids. D. Provide sedatives. Answer: A. Administer lactulose. Rationale: lactulose reduces ammonia levels and treats hepatic encephalopathy. Question 25. A postoperative patient suddenly reports calf pain, swelling, and warmth. What is the nurse's priority action? A. Massage the affected leg. B. Encourage ambulation. C. Notify the healthcare provider. D. Apply heat to the area. Answer: C. Notify the healthcare provider. Rationale: these are signs of deep vein thrombosis. Immediate medical evaluation is required to prevent pulmonary embolism. Question 26. A patient receiving total parenteral nutrition, TPN, develops a blood glucose level of 350 mg per deciliter. What is the nurse's priority action? A. Stop the TPN abruptly. B. Administer insulin as prescribed. C. Encourage oral intake. D. Reduce fluids. Answer: B. Administer insulin as prescribed. Rationale: hyperglycemia is a common complication of TPN. Insulin management is required without abruptly stopping TPN. Question 27. A patient with Addison's disease presents with hypotension, hyponatremia, and hyperkalemia. What is the nurse's priority intervention? A. Administer corticosteroids. B. Restrict sodium intake. C. Administer potassium supplements. D. Encourage fluid restriction. Answer: A. Administer corticosteroids. Rationale: Addisonian crisis requires immediate corticosteroid replacement to restore hormonal balance. Question 28. A patient with a history of alcohol use disorder is admitted and begins experiencing tremors, agitation, and hallucinations. What is the nurse's priority action? A. Provide a quiet environment only. B. Administer benzodiazepines as prescribed. C. Encourage ambulation. D. Offer high-protein meals. Answer: B. Administer benzodiazepines as prescribed. Rationale: these are signs of alcohol withdrawal. Benzodiazepines prevent seizures and delirium tremens. Question 29. A patient receiving digoxin has a serum potassium level of 2.9 milliequivalent/L. What is the nurse's priority action? A. Administer digoxin as scheduled. B. Hold digoxin and notify the provider. C. Encourage potassium restriction. D. Administer calcium supplements. Answer: B. Hold digoxin and notify the provider. Rationale: hypokalemia increases risk of digoxin toxicity. Medication should be withheld. Question 30. A patient with a chest tube suddenly has no drainage, and the patient reports increasing dyspnea. What is the nurse's priority action? A. Clamp the chest tube. B. Assess for kinks or obstruction in the tubing. C. Lower the drainage system. D. Document findings. Answer: B. Assess for kinks or obstruction in the tubing. Rationale: sudden cessation of drainage with dyspnea suggests obstruction. Immediate assessment is required. Question 31. A 64-year-old patient with a history of stroke suddenly develops slurred speech and unilateral weakness during hospitalization. What is the nurse's priority action? A. Document the findings and reassess in 1 hour. B. Activate the stroke response team immediately. C. Administer aspirin orally. D. Place the patient in Trendelenburg position. Answer: B. Activate the stroke response team immediately. Rationale: time-sensitive stroke intervention is critical, early activation improves outcomes. Question 32. A patient receiving 4 vancomycin develops flushing, rash, and hypotension during infusion. What is the nurse's priority action? A. Continue infusion at the same rate. B. Stop the infusion immediately. C. Administer epinephrine. D. Document findings only. Answer: B. Stop the infusion immediately. Rationale: these are signs of red man syndrome, stopping the infusion is the priority. Question 33. A patient with severe asthma exacerbation is not responding to bronchodilators and shows decreasing oxygen saturation and silent chest. What is the nurse's priority action? A. Encourage deep breathing. B. Prepare for intubation. C. Administer oral steroids. D. Reassure the patient. Answer: B. Prepare for intubation. Rationale: a silent chest indicates minimal airflow, this is impending respiratory failure. Question 34. A patient with suspected sepsis has a lactate level of 5 millimoles per liter. What does the nurse recognize as the priority implication? A. The patient is stable. B. Tissue hypoperfusion is occurring. C. No intervention is needed. D. The patient is dehydrated only. Answer: B. Tissue hypoperfusion is occurring. Rationale: elevated lactate indicates poor tissue oxygenation and severe sepsis. Question 35. A patient receiving PCA morphine is found difficult to arouse with shallow respirations. What is the nurse's first action? A. Stop PCA and stimulate the patient. B. Call the provider. C. Administer naloxone immediately. D. Document findings. Answer: stop PCA and stimulate the patient. Rationale: initial action is to stop the source and attempt stimulation before administering reversal agents. Question 36. A patient with a new colostomy reports no output for 24 hours and abdominal distension. What is the nurse's priority action? A. Reassure the patient this is normal. B. Assess for bowel obstruction. C. Encourage high-fiber foods. D. Increase fluid intake. Answer: B. Assess for bowel obstruction. Rationale: lack of output with distension may indicate obstruction, requiring urgent evaluation. Question 37. A patient with eclampsia begins to have a seizure. What is the nurse's priority action? A. Insert a tongue blade. B. Turn the patient to the side. C. Administer oxytocin. D. Check blood pressure. Answer: B. Turn the patient to the side. Rationale: protect airway and prevent aspiration during seizure activity. Question 38. A patient with heart failure is prescribed spironolactone. Which laboratory value requires immediate attention? A. Sodium 138 milliequivalent/L. B. Potassium 5.8 milliequivalent/L. C. Calcium 9.2 mg per deciliter. D. Magnesium 1.8 mg per deciliter. Answer: B. Potassium 5.8 milliequivalent/L. Rationale: spironolactone is potassium sparing, hyperkalemia is a dangerous complication. Question 39. A patient receiving chemotherapy develops a temperature of 38.3 degrees Celsius 100.9 degrees Fahrenheit. What is the nurse's priority action? A. Administer acetaminophen. B. Notify the healthcare provider immediately. C. Encourage fluids. D. Reassess in 2 hours. Answer: B. Notify the healthcare provider immediately. Rationale: fever in immunocompromised patients may indicate neutropenic sepsis. Question 40. A patient with diabetic neuropathy presents with a foot ulcer that is foul-smelling and necrotic. What is the nurse's priority action? A. Clean and dress the wound. B. Notify the healthcare provider. C. Encourage ambulation. D. Apply lotion to surrounding skin. Answer: B. Notify the healthcare provider. Rationale: necrotic, infected ulcers may require urgent debridement or advanced treatment. Question 41. A 70-year-old patient with a history of atrial fibrillation suddenly develops right-sided weakness and aphasia. The symptoms began 30 minutes ago. What is the nurse's priority action? A. Administer heparin immediately. B. Obtain a stat CT scan of the head. C. Give aspirin orally. D. Monitor vital signs every 4 hours. Answer: B. Obtain a stat CT scan of the head. Rationale: a CT scan is required immediately to differentiate ischemic versus hemorrhagic stroke before initiating treatment. Question 42. A patient receiving magnesium sulfate for preeclampsia has absent deep tendon reflexes and a respiratory rate of 10 breaths per minute. What is the nurse's priority action? A. Continue infusion. B. Administer calcium gluconate. C. Increase 4 fluids. D. Notify the provider only. Answer: B. Administer calcium gluconate. Rationale: these findings indicate magnesium toxicity. Calcium gluconate is the antidote. Question 43. A patient with a history of peptic ulcer disease suddenly develops severe abdominal pain with rigid, board-like abdomen. What is the nurse's priority action? A. Administer antacids. B. Prepare for emergency surgery. C. Encourage oral fluids. D. Place patient in high Fowler's position. Answer: B. Prepare for emergency surgery. Rationale: signs indicate perforation, a surgical emergency. Question 44. A patient with chronic obstructive pulmonary disease develops sudden confusion and drowsiness. Arterial blood gas results show elevated PaCO2. What is the nurse's priority interpretation? A. Respiratory alkalosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Metabolic acidosis. Answer: B. Respiratory acidosis. Rationale: elevated CO2 indicates hypoventilation leading to respiratory acidosis. Question 45. A patient with acute renal failure has a BUN of 90 mg per deciliter and creatinine of 5.0 mg per deciliter, with decreased urine output. What is the nurse's priority action? A. Encourage oral hydration. B. Prepare for dialysis. C. Administer potassium supplements. D. Restrict protein intake only. Answer: B. Prepare for dialysis. Rationale: severe renal failure with elevated waste products requires renal replacement therapy. Question 46. A patient post-cardiac catheterization develops swelling and bleeding at the insertion site. What is the nurse's priority action? A. Apply firm pressure to the site. B. Elevate the affected limb. C. Notify the provider. D. Assess distal pulses. Answer: A. Apply firm pressure to the site. Rationale: immediate pressure is required to control bleeding and prevent hemorrhage. Question 47. A patient with suspected anaphylaxis presents with wheezing, hypotension, and facial swelling. What is the nurse's priority action? A. Administer antihistamines. B. Administer epinephrine. C. Provide oxygen only. D. Start 4 fluids. Answer: B. Administer epinephrine. Rationale: epinephrine is the first-line treatment for anaphylaxis. Question 48. A patient with increased intracranial pressure suddenly develops bradycardia, hypertension, and irregular respirations. What is the nurse's priority interpretation? A. Hypovolemic shock. B. Cushing's triad indicating impending herniation. C. Normal neurological response. D. Early sepsis. Answer: B. Cushing's triad indicating impending herniation. Rationale: this is a late sign of increased ICP requiring immediate intervention. Question 49. A patient with a tracheostomy becomes agitated and the nurse is unable to pass a suction catheter. What is the nurse's priority action? A. Remove and replace the tracheostomy tube. B. Administer sedation. C. Call respiratory therapy. D. Provide oral suctioning. Answer: A. Remove and replace the tracheostomy tube. Rationale: inability to pass a suction catheter indicates obstruction, immediate airway management is required. Question 50. A patient with severe hypoglycemia becomes unconscious and has no IV access. What is the nurse's priority intervention? A. Administer 4-dextrose. B. Administer glucagon IM. C. Provide oral glucose. D. Wait for IV access. Answer: B. Administer glucagon IM. Rationale: in an unconscious patient without IV access, IM glucagon is the fastest life-saving intervention. You just completed 50 Nclex questions that truly test your confidence level. Not just what you know, but how you think under pressure. If you found yourself second-guessing, that's not failure, that's exactly where growth happens. Nclex is not about memorization, it's about priority, safety, and clinical judgment. Keep training your mind to think airway before everything. Recognize early versus late signs. Act fast in life-threatening situations. Avoid the trap of just monitor. The more you practice like this, the more your confidence becomes unshakable on exam day. If this challenged you, you're on the right path. Don't stop here, keep pushing your limits, because the real exam won't go easy, and neither should your preparation. Subscribe for more high-level Nclex drills that sharpen your thinking and make you exam ready. See you in the next one.